Good evening. We have with us Dr. Anirban Chaudhary, Director, Professor, Critical Care, Safdarjung Hospital and Vardhaman Mahavir Medical College. We welcome you to the Natco Specialty Studio this evening. We want to listen to your words of wisdom or advice, the young generation of doctors. Those are associated with critical care and especially in bacterial resistant treatment. What, as per you, doctor, is your take on the changes that have happened in critical care management?
The changes that have happened in critical care management is still happening, and the world is watching. How critical care started in 1946 in a four-bedded hospital has magnified and spread across the borders and emerged as one of the primary specialties across all cities of the world, across all sections of people, and catering to the varying needs which were remaining unmet by the practitioners of chronic medicine. So, the growth of critical care is a recognition of the need for acute medicine for most of the people at large, and the society has been tremendously benefited by the practitioners of critical care medicine, and they are getting benefited more in the days to come when AI is getting incorporated, when researches in omics, the proteomics, genomics, metabolomics is spearheading critical care research and is leading to opening up new vistas and avenues in the days to come. So, no doubt that other than oncology, no other field has seen such wide dimensions of growth as much as critical care has seen. And regarding your antimicrobial use and resistance, I cannot resist but tell you about a story of Rasputin. Have you heard the name of Rasputin?
Yes,
During
Bonnie M. Song.
Yes, you have. Well, it's Bonniam song, and during the Tsar rules, he was a he got tremendous. He was a preacher, so he got tremendous publicity, and he became one of the most powerful with Tsar Nicholas regime. And finally, he because of his lot of other nefarious activities made him lot of lose his popularity also. And finally, he was killed. Now, before he was killed, he was poisoned. He was poisoned with a chemical which kills 99.99% people of the world, and that is potassium cyanide, and he didn't die. And it is said that he had some enzymes which was resistant, and finally he was killed by he was beheaded. The point remains that whether Rasputin had a resistance to potassium cyanide is still a mystery. But antimicrobial resistance is emerging as the biggest challenge and becoming one of the biggest drivers of antibiotic usage is a fact. And when the fact remains so immaculate like the resistance factor, we know that one, two, three, or four factors cannot just hoodwink this resistance phenomenon. To conquer resistance, a lot of groundwork needs to be done, starting from the use of antibiotics in fisheries, use of antibiotics in animal husbandries, in plant products. And so it has to be taken. It is not just the practitioners of modern medicine who it is in their hands. It is in the hand of the society, on the various parts of the society, and we need to address this issue with much bigger dimension, with much multi-pronged way to overcome this. And I don't want to add the same things that Dr. Ghosh has already stated, that these are very important, indeed important, that we have to rationally use, avoid unjudicious use, tailor them, stop the therapy at the right time, never use more than two drugs unless there are definite reasons to do so, all fair. But it should also mean that we should develop a holistic viewpoint about the non-antibiotic treatment strategies. A lot of time body's own immunity is good enough, and body's own immunity should be made capable of warding off the infections in the best possible way. Probably that would be the answer to the menace of antibiotic resistance in the days to come.
You brought in an history from 1946 and also the example of Rasputin, I'm sure is very encouraging to understand resistance. one message you like to give the young generation today, especially those that are in the ICU and who are in patient care?
Today's youth will be tomorrow's old. Today's old were yesterday's youth. So this is a cyclical process, and one need to understand the system on an as of now basis. What was right then may not be right today. What is right now may not be right tomorrow. So that changing paradigm should be understood, accepted, reflected upon during actions, and also passed with to the next generations.
You have already spoken a bit on the antibiotic resistance, but if you can still give us an highlight on the prevalence of carbapenemeth, bacteria, producing bacteria in the practice, and what, according to you, is the treatments?
You know the escape organisms. I won't going to detail out, but yes, the carbapenem CPR organisms are on the rise, and our concern is primarily with the three: the Klebsiella, the Acinetobacter, Pseudomonas, and of course, to some extent, the E. coli. So primarily these four. And we are gaining confidence by using other drugs. Otherwise, we were already using a lot of time poly B and colistin. And now we know that without using colistin and poly B, also there is a respite to ward off these infections by judicious use of other drugs. But it is more important to use the drug in the right dose to so that the drug achieves its right concentration at the site of infection. And we know that what the drug particular activity, just a drug being reported as a resistant may not be resistant. If it achieves a good concentration for that particular site, it may still work. And similarly, a drug which has been shown sensitive may not actually work if its concentration achieved at the site of infection is too low. So, a lot of those PKPD parameters needs to be appreciated, understood, applied, and then definitely even the resistant drugs can be made to work better, and the sensitive drugs can be used with much wider judicious caution.
Dr. Anirban, I thank you so much for your time. I love the passion that you bring out. Both you and Dr. Ghosh have brought out that passion in trying to explain, what the scenario is of today and also of the years gone by. So thank you so much for your time,
Thank you
and
for your questions.
we wish you all the best.